Okay, hello everyone, and welcome back to another episode of the Longevity Lounge. Today we have Dr. Jenkins, and Dr. Jenkins really needs no introduction because he's been on the episode or on the show before. But Dr. Jenkins, just for those who may not know you, do you mind just sharing a little bit about yourself and what it is that you do?
Yeah, sure. I appreciate the ability to come back on the podcast. It's a lot of fun. Yeah, my name is Dr. Dylan Jenkins. I'm from the Minnesota area. I graduated from chiropractic school December of 2019 and then went full steam ahead and signed a lease, did a build out, opened my own practice right away March 1st of 2020.
Wow.
So it was a very interesting time frame to be trying to open a practice, brand new, right?
Yeah.
So a lot of fun with that, a lot of growth with that. My practice is thriving. I've been extremely blessed, so I'm very, very happy about that. So I'm a chiropractor, as I had mentioned, and the kind of the cool thing is, I was actually introduced to BEMER through my parents while I was a chiropractic student. So I was, lugging a BEMER around the school, introducing it to faculty and administration and colleagues, really quite literally daily, and giving them sessions and things like that. And no one knew anything about BEMER at the time. So that was back in early 2016 when I was initially introduced to it. So fast forward, we're 9+ years later, and now I've been in clinical practice for 6 years, and I use it on every single patient that comes into my practice. And I've been able to move up and become part of management within BEMER and help build a small team and support people in the local area. And I love it. It's been a really good time. So, chiropractic is obviously my main thing, right? My practice is my main thing, but I use BEMER every single day with not only myself and my family, but also the clients that come into my practice as well.
That's awesome.
Yeah.
Something I haven't had too much experience with chiropractic care myself. I've had maybe one experience. I've not gone frequently. I guess maybe I need to go more. I don't know. Um, but something that seems apparent to me is that behind chiropractic care, there's kind of like some core principles of things that you stick to within your practice and how you offer that care to your patients. What would you say that that is from your experience? Like, what are the core principles?
It's a good question. And I'd say it's going to depend and it's going to change depending on the chiropractor. So it's kind of the double-edged sword with chiropractic. When you go to a chiropractor, maybe you get a great result, maybe you don't. Just like going to a physical therapist or going to a personal trainer, right? Like you may, really vibe well with that person. You like the way they communicate and respond and like work with you. Chiropractic's the same thing, just like any other doctor or any other profession. So what like chiropractic school teaches you is that they're going to try to help you with a great knowledge base with nutrition, diet, obviously, lifestyle, and then spinal adjustments, extremity adjustments, and trying to get the spine moving appropriately is all of the important things when you're kind of going through the school curriculum. Myself personally, I practice applied kinesiology, which is I guess I would say it's a type of chiropractic, or maybe even a philosophy of chiropractic. And basically what that means is, I test muscles and I see how well the nerve may leave the spine and communicate to muscle. So we use that ability to have a person or a patient like yourself, like you said, I don't have a lot of experience with chiropractic. It's like, okay, that's great, that's cool. Let's test how well your body is doing, and then you as the patient will know if things are working well or not. It becomes very apparent and very obvious. So if a person comes in and they're having pain, it's like, well, yeah, chiropractic might be a good thing, but then when you can do a muscle test, or you can show them that, like, hey, when you do this, is the pain better? Yeah. When we do this, is the pain worse? Definitely don't do that, right? If you know how to like ask the body the right questions, the body will ultimately show the answer. So the bigger thing with this is, in my philosophy, there's kind of a triangle to health. So chiropractors get really good at treating structure, right? So we can go and adjust muscles, we can do muscle work, we can adjust the joints, we can reposition bones. We're trained to do that. And then on the other side of that, you got chemical, right? So the things that we put in our body, whether that's supplements, pharmaceuticals, the water we drink, the food that we eat. And then at the top of equal importance, that's really not touched on a whole lot, is emotional health, right? So, and people will be like, oh, no, that's crazy. But think of it this way. Like, have you ever been really stressed and you realize like how tight and tense your shoulders are.
Mm.
Like people carry stress, whether that's emotional stress that they think of it as emotional stress, but they carry it and it physically taxes the body. So being able to find someone that you're really comfortable with, whatever that might be, is a really important thing for a person to actually feel comfortable to move forward in their health journey too. So trying to be approachable and communicate well with people is, I think, another important thing that's maybe missed occasionally.
Yeah, that's really interesting. And this is a really odd question, but I've also wondered this myself. Like, do you ever get adjusted yourself? Like you're always working with other people. Do you ever do that? Like, how does that work for you?
It's a great question, and it's commonly asked in my practice because I'll be on I'll be on my feet adjusting patients from 8 to 6, right, 8 a.m. to 6 p.m. all of my long days, and I might see, I don't know, 20 patients in a day. I book on length of time of appointment. It's not just like constant go 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 go, which is part of the reason that some people don't like traditional chiropractic is that you might get in and out and adjustment in like 2 minutes, and they just don't like that. And I personally don't practice that way. It wasn't something that I've resonated well with. So to answer your question is I have a few colleagues of mine that I do reach out to. I do try to stay adjusted on a regular basis because ultimately, if I'm not taking care of myself, I can't take care of my patients. And that's really the overarching thing for everything. Right? We have to take care of ourselves if we want to be there to help others as well. So I do my best to get adjusted regularly. I do get massage quite often. I use my BEMER every day. I've got other therapies that I use in my practice every day, and then I'm just really good with really good. I'm relatively good with my diet, and then I do some supplements that I do on my core supplements from some genetic testing that I've done to know where I need to best help my body.
Okay, cool. I've always wondered that because you see it all the time. Like, oh, how did you can't adjust yourself really? So, no, that's awesome. But it's something that came to my mind as you were sharing that is this idea of preventative care, and I think ideally you'd like to prevent the problem before they even come to you. But for a lot of people, they don't know how to prevent problems coming in terms of keeping their spine and their neck and their back healthy. Um, it seems like they kind of just wait until a pain or an injury comes and then they come to you. So, um, what would you say are some, I don't know, good practices for preventative care for people listening on keeping their back and their neck healthy or the muscular system to prevent problems from happening?
So the preventative care is the number one goal, right? We don't want to be injured. We don't want to get sick. We don't want to wait till there's a problem. We want to be proactive. And I love the way that you even kind of like pose the question is, ultimately what can I do now so that I don't have to hopefully go see a chiropractor or I don't have to rely on someone, right? I mean, that's everyone's goal. So what I share with my patients, things that are totally attainable and they're in the wheelhouse of you guys. First of all, you need to be hydrating your body. So drink water, right? Drink clean water, purified water, as good a source as you can. But when we say hydrate the body, that does not mean just like fluid volume intake. I had a patient just recently come in and she drinks like a gallon of water a day. And she's getting crazy muscle spasms and Charlie horses in her legs, super low energy. She gets really dizzy when she stands up from a sitting position. And we did her blood pressure screening and we did some blood work on her and she's super deficient in electrolytes because she's drinking too much water. So she's overhydrated. She's not putting enough minerals and good things back into her body to, again, keep a balance. So, too much of a good thing can also not be something that's maybe good for that individual. So, it is dependent upon the person. One other piece of this is when we're talking about spinal health and neck health, it's not really fair. You and I are sitting down having a conversation right now. Sitting has an average of about 200 times more pressure on the discs than when we're standing and when we're moving around or lying down. So sitting in of itself is not kind to the spine. So we encourage people to get up, take breaks, have a sit to stand desk as much as you're able. Things that break up the monotony of a work day, those things are important. We want to offload the spine. And then when it comes to neck health, I don't know if you've ever seen it, but when you're working on the desk, right, people kind of start leaning forward and they get closer and closer to that screen. Well, over time, they can form like that hump that shows up in the backside of their head and neck and their shoulders start to roll forward. That's a postural change. Gravity is not kind, right? So if we can start to help share and say, okay, strengthening your spine and improving your muscle in the spine and in the neck can support a good posture, that's going to ultimately protect a person too. Again, you said something that was a pretty good indicator that I like to share with people. The last thing that a person experiences is pain. Like, the human body will never cease to amaze you. If you just take a step back and you think, oh my gosh, I can compensate, I can heal if I scrape my arm, like I can do all these incredible things. If we put the body in the right environment, it can heal itself. It will also compensate until it no longer can, and the last thing that shows up is pain. So the example that I see almost every week in my practice is you got a construction worker who is just lifting, heavy objects, working, shoveling all day long. Yeah, maybe they're a little sore, a little achy. They go home, they shower, and they bend down to dry their feet, and they throw their back out. The body was compensating, and all of a sudden, boom, they got hit, and then they got that severe back pain down the leg, and you no longer can, right? So if they would have been maybe a little more conscious of better hydration, maybe decompressing the spine, doing some backwards bend, doing some stretches, maybe we could be avoiding these major problems before they even arose to begin with too.
Wow, that's so fascinating. And I remember on the last episode that you did with us, you talked about this a little bit, where you elaborated on how drinking water it's so much more than just hydration, and you elaborated on like muscle tone, inflammation, soreness, stiffness. And I remember you sharing that, and you also talked about energy as well, kind of water being the best natural energy drink, obviously assuming it's got sufficient electrolytes and everything else.
Right.
And I remember listening to that and I was like, man, I need to drink way more water. But as you said earlier, like, not just volume, it's the right kind of water. So do you mind sharing a little bit about that again for our audience and just helping them understand that point? Because it's true, like, it's so much more than just the volume of the water. It does so much for your muscle, for recovery, and everything else. And I thought you worded that in such a great way last time.
Yeah, so I like data, I like numbers. So I use some technology in our practice that lets us know something called a bioimpedance analysis. So I measure hydration status in patients all day, every day, like all the time. So I've become rather fluent in being able to say if a person's doing well or not. Their body will never lie. So if they say they're drinking enough water, they're doing enough things, we'll just do the test and we'll let the test numbers ultimately be the guide. So when we drink water, right, we have to put the water into our body to begin with, but that doesn't mean that the body even does anything. Most people in the audience that might be listening to this, they might be thinking to themselves, if I just drink more water, I just pee more, right? Like, I just pee a lot more if I drink more water, so why would I want to do that? And part of the problem for those individuals is they're so mineral and electrolyte deficient that their body can't actually use the water, and it's just going right through you. So, the color of your urine, that's been a classic thing. You want to have a straw, pale yellow urine that lets you know that you're well, adequately hydrated. If it's super clear, you might be overhydrated, or again, you might not be using that water really well. And if it's really, really dark, really, really smelly, you're dehydrated, okay? Now, a person's going to be most dehydrated first thing in the morning, because that's when our body's been detoxing and cleansing and getting rid of all that bad stuff. And I don't know if you've ever noticed this, but when you get up and urinate first thing in the morning, again, it's a lot darker in color. It's usually a lot of it smells a little bit stronger. And again, that's your body's getting rid of the junk. So I don't know about you, Ethan, but I'm a coffee drinker. I love my coffee. I do organic black coffee most days, but I kind of make myself earn my coffee. So the way that I make myself earn my coffee is I do 16 ounces of water. I do electrolytes in my water. Maybe even some quality salt in the water before I'm allowed to have my coffee. Because you're first thing in the morning, you're super, super dehydrated. We don't want to go and reach for coffee and further dehydrate our body. I mean, our muscles are on average 70% water. So if we live in a chronically dehydrated state, yeah, your muscles are going to be sore and tight and achy. And you're not going to stretch and have good mobility. You're not going to feel good. Now, the other kind of, if you want to go down the rabbit hole, which is fun for me, when you drink water, there's a balance between the water that actually gets inside your cells, called intracellular water, versus the water that stays outside the cells in the extracellular water. And what we see is as we age, there is a natural change to the ratio for both men and women in which how much water we ultimately want to be driving into the tissue for optimal health. And what we see in our practice is those that drink good amounts of water may have good hydration, but those who drink good amounts of water and make a conscious effort of putting in the electrolytes and minerals far outweigh the benefits of the ability to drive the water into the cells, which is ultimately the goal, right? So we want to be bringing all that good stuff into the cells. So again, it's the ability to drink good water, put the right things with the water. You know, people might be asking, well, what can I do at home, right? And what I share, it's pretty general, but take fresh squeezed lemon juice, organic lemon juice if you're going to buy it in a bottle, cut a lemon in half, squeeze that into your water. You know, some with my patients that we've identified, they're not super salt sensitive. We'll say take a Celtic salt or a Redmond's real salt, maybe do an eighth or a fourth of a teaspoon depending on the person, add that into your water, mix that up and drink it. And that's a way that you can do a real quick home remedy that can be really helpful. And we'll tell a lot of our patients to go ahead and pursue that. And they start to see some really good change. And again, the amount that they urinate with their increase in volume typically does change as well, which is good.
Mm. Wow, that's really insightful. And something I'm wondering now, is there any, and you maybe you know this, maybe not, is there any benefit to like timing when you drink? Because sometimes I find that where I'm like, oh, I've not drunk enough water. I need to like get it in right now. But does that really have any benefit?
So it's a good question. Here's the thing that I'll share. I would prefer people to kickstart their day with water intake, the electrolyte, the mineral intake. That's the best way to just give your body the success to have a good recipe of a day. Start with a good day. Start with by putting that hydration in. And then ultimately, we don't want to be drinking a lot of water at mealtime. Like limiting fluids at mealtime helps our body effectively digest more. Like we have better gastric juices for the digestion process. So if we drink a large volume of water, it makes it difficult to digest food and we don't feel good. So I would say maybe limiting your fluid intake at mealtime, kind of trying to get it in between meal times. And then I don't know about you, but I get busy sometimes and I don't drink as much water during the day as I would like to also. And then I get home and I get to bedtime and it's like, I just keep guzzling and guzzling water. I'm trying to catch up on like, oh my gosh, like I'm so thirsty right now. Or if you wake up in the middle of the night and your mouth is dry, it's because of how dehydrated you were in the middle of the day and throughout, the earlier in the day, and you're trying to catch up. And for certain people, they might struggle that if they're trying to increase their fluid intake in the nighttime, it increases the amount of trips to the bathroom, right? So we would, for certain individuals, they may need to taper their fluid volume as they're getting into the evening. So again, those are people who have to front load the day so that they can stay in that better balance also.
Mm, that's so real. And I've heard it said that if you're thirsty, it's probably too late. It's probably good to start off with a good routine and just keep the flow because that's the sign. It's like, your body's struggling now. Um, I love that. Something you mentioned earlier, and this is again perfect timing. Talk to a chiropractor, but I feel like there's a lot of debate. You talked about kind of the hunchback, having a hunched over posture, how that can lead to that awkward hunched over look. Um, and I think there's definitely a misunderstanding on what is natural posture and curvature and what is good posture. I feel like there's a lot of debate, or at least in the circles that I'm in, where it's like, hey, straighten your back, healthy back, straight spine. But sometimes it seems like, well, yes, but also there is some curvature. And so, but I also think people don't know how to how to find the balance of what's healthy, what's not. You talked about it earlier, but do you mind elaborating on that concept of, there's curvature in our spine, but we shouldn't be too hunched over for too long. How do we find the comfort in just like, okay, this is just how I sit. I'm okay with this. Like sometimes you can get in your head, you're like, I shouldn't be sat like this, or maybe is this normal? I don't know if it's normal. How do we find the balance, and how do we feel comfortable in our posture?
Yeah. So again, everyone's different, but we can talk about what would be optimal, right? So optimally, a spine has a curve in the neck, and you have a little bit of a curve in that mid back. and then you have a curve in your low back and the lumbar spine. The purpose of the curves in the spine are to kind of act like a spring, right? So if I put compression in on that spine, it has flexibility and it has movement. If we have a spine that stays perfectly straight, there's not a lot of room for error for pain to start showing up in that individual. So we like to have good curvature. Now, gosh, I don't have the right number, but it's the vast majority of people have this like forward leaning head and this forward leaning neck posture. And I see it everywhere I go. You know, I'm a people watcher at heart, right? So I love to go to the mall, or I'll go to a local sporting event, and you just look at people on their phone, right? And I just want to go up to them and be like, lift your head, you know, bring your phone to your face. So I think one thing that a person can be more conscious of is just bringing that phone up, trying to get it closer to eye level, not leaning so far forward. Is a small thing that you can make that conscious effort that will make a large change. I mean, if you guys are listening to this right now, or Ethan, if you even want to do it, pretend like you have your phone in your hand and look down as if you're looking towards your lap. Do you feel the tension that shows up in the spine? And the tension that shows up in your shoulders? That's not great long term, right? So if you bring that phone up to your face and you naturally like raise your head, that discomfort or that tension in your spine and that neck tends to go away. So that's one small thing a person can do. Another thing that I like to share with my patients, again, totally in the wheelhouse of a person at home, costs you $0, is just doing like a back bend or a back bridge people might be familiar with. So again, trying to open the chest up and actually lean backwards. Typically a person would be doing this maybe on the floor where they're trying to create that bend in the spine. Some people do opt to purchase maybe like a foam roller, or they'll get a big bolster or a large amount of pillow, and they can lay over that and have kind of that natural decompression in their spine. And then I got people that like to use them like a Bosu ball, if you're familiar with that, right? It's got that flat platform with that ball on top, and they'll lay on that and let their spine just decompress, and it feels so good. And again, in the wheelhouse of someone that they can do at home, preventative maintenance, getting pressures off the discs. You know, yes, there are certain postures that might be better than others, but I think it's trying to unwind the spine and like unwind the cruelty to gravity that we become involved with day in and day out. And again, stretching the body, doing these small things where you can decompress and just change little habits do make a large compounded effect throughout the rest of the day too.
Would you say that you talked a lot about decompression and stretching out your spine, avoiding the little things that can compound and lead to the problems in your posture or stiffness or pain? Would you say that daily decompression is valuable, that should be a routine habit for everyone?
Yeah, I mean, in my practice personally, I do decompression style adjustments almost universally. So I will almost never, I mean, maybe 5 times a year, will I do a traditional side posture lower back adjustment. That's taught in school. I just don't really do it. I do a lot of different style of adjusting, and I love decompression. So we'll do a lot of tractioning out of a person's leg, tractioning out of their lumbar spine, decompressing the hips and the pelvis structure. Same thing with the neck. We'll do a lot of like elongation, working through the muscles. Occasionally we'll do rotation, but it's mostly like traction, decompression style of adjusting and getting the pressure out of the spine. And if a person, if it feels good, it's generally the body saying that it likes it. So if you're going to go and start practicing some like spinal decompression daily and it feels good, well, it's kind of obvious that that's probably a good thing for you. If you start doing something that creates pain, pain's a great indicator. It's like the body doesn't like that. Now, training your body and going to the gym can be uncomfortable, and that's purposeful, right? We're creating purposeful tissue change. But if you're just doing like a passive stretch or a passive decompression, it shouldn't be painful. So I let people have like that judgment of, does this feel good to me? Kind of be the guide. And if it feels like if it's too much or if it's uncomfortable, then maybe back off a little bit.
Yeah, that's something I've found is one of the first things I do. before any workout, any exercise, whatever I'm doing, I typically like to just hang off of a bar. For whatever reason, I can feel it all
Hmm.
through my body. It just seems like overall, it's like the biggest decompression I could have, and it just opens me up so much. And I think that's good guidance because I'm sure everyone listening to this is probably adjusting their back and they're like, oh,
Yeah.
more aware of their back all of a sudden. Um, but I think that's good, like good advice. So good recommendations. It's like, okay, if it feels good, it's probably a good thing. If it's, just listen to your body. Uh, and I think that, yeah, I think that's valuable. And something I wanted to jump into as well here, kind of jumping into another subject, is you talked about implementing BEMER, BEMER technology for yourself, with your family, for your patients. How do you personally like to use BEMER in conjunction with chiropractic care, and how does it make a difference for the people that you work with?
So if there are other, chiropractors or massage therapists, physical therapists, etc., different practitioners or people that do different work on people, they may do it differently. But I can just speak to how I use it in my practice. The vast majority of my patients will generally receive BEMER therapy after I'm done working on them. Whether that's nutritional consultation, genetic consultations, spinal adjusting, other therapies in the clinic, we usually end with BEMER. My theory behind that is I want to calm that nervous system and put that body into a really, really relaxed state before they get on the road and get in their car and drive 65 miles an hour down the road, right? So I want to just like let them mellow out and take 8 minutes to just take some breaths. So I really like that. I do have patients that sometimes I will actually put them on the BEMER first. I can speak to a patient case just this week. They came in, again, construction worker threw his back out. Can't hardly move when he came in. We had him on the BEMER prior, B-sit underneath his hips, strap, B-pad across his low back. He threw his low back out. So we were targeting that area with the goal of loosening the tissue up. So we're driving oxygen, nutrients, blood flow into that tissue. Generally, we get a really good response in getting that tissue to loosen up, which allows me to do better work for them. And hopefully it's a lot less sore that when we do that work. And just last night, I had someone on spinal decompression therapy. Ironically, we have a table that we put them on, and they were getting great decompression out of the lower back. And he got up and he was pretty stiff. The muscles were kind of spazzing almost. They were just kind of tightening up on him. We put him on the BEMER. 8 minutes later, he got up and he's like, "Oh my gosh, I feel like $1,000,000." And he's just like that. He's like, I couldn't even hardly move before, and now I feel incredible. So again, patient case matters, of course. So for again, no matter what the person's coming in with, though, we're using BEMER. I want my patients to experience that passive modality of being able to lay on a BEMER and get that amazing benefit, and then be able to like leave my practice and continue to receive that benefit for the next 12 to 18 hours. So I have 6 BEMERs in my practice. I operate out of a couple different locations. I got a BEMER that stays at my house. I got a couple 2-3 for rental. So if I have patients that have a major injury and they need a BEMER to go home with to recover, we'll send them out with a rental. Patients that may want to say, hey, this might be a good fit for me in my lifestyle. Can I use BEMER in my home for a couple weeks and see if it is? Awesome. I want you to make the best educated decision if it's going to be a part of your life, rather than just getting a BEMER session maybe once a week, right? So again, time and place, everyone's going to be different, but that's the general consensus of how I like to use it.
Wow. That's amazing. I'm sure you've seen some amazing reactions and responses. I think that's when I see chiropractic care or content videos, I feel like they get so much engagement because you can see such a transition. I don't know if you have any opinions on that, but I find it quite satisfying watching those videos. And I think BEMER has been such a huge part of so many people's lives, and there is a very real, genuine response to using it. If you were to leave our audience kind of in a closing message here with one primary piece of advice on preventative care for their back, for their neck, good posture, bone, muscular health, whatever it might be, from your experience and expertise as a chiropractor, uh, what would you share with your audience right now?
I would say the challenge that I provide my patients, and when I get to do public speaking with BEMER, is I tell people that what you're doing today is not for you today. it's for your benefit 10 years from now. So anything that we do that's of a positive benefit to us is going to only be more beneficial to us in the future, because we can't go back in time. We can only start with what we can do today and move forward. So again, that's why I love my BEMER. I hydrate, we do all the stuff. If we're not doing the right health decisions today, there's a higher likelihood that we'll struggle in the future. So I love to lean on other practitioners and other people that are really, really great professionals in my surrounding community. My wife's a physical therapist. I love physical therapy. I think it's a great time and place for occupational therapy, physical therapy. Of course, we use orthopedics as needed. Hopefully, less than what a typical person may be. Right? We have some similar small amount of referral as needed, but I like to also refer people to just their local gym, and I say, hey, go to your local gym. There's some personal trainers who are going to be plenty knowledgeable and being able to really help you, because if we can get you moving your body in a way that you enjoy, that's the best thing that you can do. Muscle's the number one marker of longevity, and muscle's the number one thing that will help a person maintain a healthy posture. So if you can invest into yourself into doing any form of movement, just challenge yourself 10 minutes a day doing some form of movement, whether that's dancing, whether that's walking, whether that's lifting weights. I mean, I don't care what it is. I want you to pick something that you really enjoy and just start with 10 minutes or start with 5 minutes, whatever it is, and then just try to do better the next week. So I'd say movement, getting in a community of people. That's why I love like the personal trainer. They're really encouraging. They're great. You get into a community that, you got people maybe like-minded around you. It's going to motivate you. So I'd say get out into an area, start moving your body, surround yourself with a community of people that you can, hopefully get along with, and they'll help push you to want to be better too. I think that's really the best thing is community, movement, start preparing for 10 years from now. If you want to live, the ending message I'll always share is, I ask the question, who wants to live to be 100 in the room? And, there's some brave hands that go up, and most of the hands don't. And I say, okay, well, who wants to live to be 100, where you have your memory, you can move, you can do all of the hobbies that you love, you get to be in a community of people who love you. Who wants that? And every hand goes up. That's never going to happen by accident. You have to go out there and make it happen. So again, create the life that you ultimately want to live.
I love that. Thank you so much for joining us today, Dr. Jenkins. We've
Yes,
absolutely loved every single minute. Thank you.
absolutely.